So when we talk about facial surgery, I like to divide it into two parts. There's the non-surgical side of things and the surgical side of things. So when people talk about non-surgical things, they're talking about Botox, fillers, lasers, chemical peels. All those things really address the quality of the skin. They're not going to do anything for the structural problems. So when we look at the face and we see how the face ages, it's really a structural issue. It's not a skin problem, it's a muscle problem. As we get older, it's the muscles in the face, it's the ligaments and the fat pads that are changing. So when you see somebody out in public and say, wow, that's a bad facelift, it's typically because whoever did their surgery took the skin, they pulled it really tight. Again, it's not a skin problem, it's a muscle problem. So as we get older, what we're seeing is these muscles and ligaments of the face get lax. So in order to fix that and get a nice natural look, we have to fix the structural aspect of the face, tightening up the muscles, tightening up the ligaments, and then we very gently put the skin back down on top of it. And that's how you can get a really nice natural look. Now, that really applies to the surgical side of things. So when we talk about surgery, we're fixing structural problems. When we talk about Botox, fillers, lasers, chemical peels, we're really talking about the quality of the skin issue. So to get an optimal result, we really have to do a little bit of both. Now, let's go through the surgical things first, and we'd like to break the face up really into three parts. The top third is the brow and the upper lids. The middle third is the lower lids and the cheek pads. The bottom third is the neck and jawline. So when people talk about facelifts, a lot of people come in and say, okay, I think a facelift does the whole thing. It really only addresses the bottom third. So you have to look at each part individually. So let's start first with the brow. And as we get older, the brow begins to heavier and begins to drop down. So it's almost like a curtain rod on a window. If you think about the curtain rod lowering halfway down the window, the drapes are going to begin to puddle at the bottom of the window. So your options are either raise the curtain rod back to the top of the window or trim the drapes. You're much better off raising the curtain rod back to the top of the window, or in essence doing a brow lift before you ever do anything to the upper lids. So as women get older, their brow gets low and it tends to make them look tired. Men can get away with it a little bit more because they tend to look a little more distinguished when the brow sits low. So in most women, we're going to raise the brow back up first, and that's just doing a brow lift. Now, when we do a brow lift, you never want to pull in the middle, because if you pull in the middle, it looks very surprised. As the brow drops down, it's dropping down the sides. So we always want to lift back up on the sides to get a nice, pretty arch back to the brow. Only once we get the brow back to where it goes do we consider taking off the extra skin in women. Now, men can be a little bit different, and men sometimes will take off a little extra skin first, because like I said, men sometimes look a little more distinguished if their brow sits low. Now, middle third is a little bit different here. In the middle third, when somebody's eyes get puffy, it makes them look tired, but there's several things going on that cause that. One is there's three little fat pads that sit here in their eye, and there's a curtain of muscle that holds that fat back. As we get older, the fat gets heavier and the muscle gets tired, just like we do, and that's why people associate this puffiness in their eyes with being tired. That's the problem, the muscle's physically tired. But the other part of the problem is this cheek pad begins to descend, and as it does, it leaves us with a groove under here, and it makes this line look deeper. So when people want Botox, when they want fillers and they want to fill this line in, really what we're doing is we're masking shadows and we're putting a Band-Aid on the underlying problem. The underlying problem is this cheek pad has dropped down. So in order to fix that, we need to raise this cheek pad up. When we raise the cheek pad up, in combination with taking the fat out, fills this groove in, it fills this line in, and makes this line look better so you're not seeing the shadow, and gives us a much more youthful appearance, and loses that tired look to the middle third of the face. Now, the last part's the bottom third of the face. The bottom third of the face is what we call facelift, or probably a better name would be a neck lift. Again, as this skin drops down, it makes us look tired and we lose the definition of the jawline. It's really not a skin problem, it's a muscle and ligament problem. So if we just take the skin and pull it really tight, it's going to look pulled. What we have to do is to tighten up those muscles and ligaments. And when we tighten up the structural support of the face, very gently put the skin back down on top of it, it looks very nice and natural. It doesn't look pulled. So facelifts and neck lifts are done through a little incision around the ear, and oftentimes a little tiny incision under the chin to tighten this back up. Now, let's touch a little bit on the difference on mini facelift and a full facelift, because there are a lot of surgeons out there that will talk about, oh, these mini facelifts or lunchtime lifts or quick lifts. Really, all they're doing is they're taking the skin and pulling it back up. The problem with that is the skin is very elastic, it's very dynamic, and it will take the shape of whatever's underneath it. So if we don't tighten those muscles up, within 6 months or a year, it just drops right back down. So for me, when I talk about a mini facelift, I don't like that term because it implies we're not doing much. We still got to tighten those muscles up. So when you're 35 years old or 85 years old, if you're seeing the jowls, if you're losing the definition, it's a muscle problem, it's not a skin problem. So even in somebody who's young, who's 35, 40, we do little mini facelifts, but we're still going to tighten the muscles up, because that's what's going to make it look nice, and that's what's going to make it last 10, 15 years. It's going to hold up long term. Now, the last part is going back to the other side of the spectrum, which is the Botox, the fillers, the lasers, and the chemical peels. So none of the surgical things are going to affect the quality of the skin. So we often combine surgical things with something like a chemical peel to help tighten up the fine lines, fix the sun damage, and correct the wrinkles in the face, things I can't fix surgically. Those are nice to combine at the time of surgery because there's a little downtime to them. The longer the downtime, the better the chemical peel, because in essence, we're going deeper into the skin in an effort to tighten all that back up. So we do this at the time of the surgery so that so everything looks nice. And if you're going to take a few days off while you heal from the surgery, it's a great time to do it at the same time because the chemical peels take about a week or so to peel off. But that's an overview of facial surgery, and I encourage you to look at the website, come see me. We do in-clinic consults, we do virtual consults. So I love the opportunity to look at you and give you an opinion on things. Look forward to seeing you soon.